Today, health insurance reform becomes law in the United States of America.
Health insurance costs are climbing.
How much healthcare costs have risen.
Rising healthcare costs.
What is really going on with healthcare costs?
Hey, I'm Robert with Common Care, and in the next 5 minutes I'm going to prove to you why you are losing money by not offering a group health plan to your employees, no matter the size of your company. Not group health insurance, by the way. That's a terrible way to set up a group health plan. Allow me to explain. The Affordable Care Act, or ACA, is what defines what group health plans need to look like. Under the ACA, employers with more than 50 employees are required to offer a minimum value healthcare offering. Employers with less than 50 employees are not required to do so. And if you've ever looked at the cost of offering group health insurance, it's understandable why anyone with less than 50 employees would not pay those premiums. Only a mandate would get someone to do something like that. That's quite a tragedy for a few reasons. First, the best savings in all the tax code are for employers who offer group health plans. Second, you can offer a group health plan without purchasing group health insurance or even contributing anything to the group health plan. How is that possible? Even if your employees aren't receiving a company health plan, they're still consuming health care at about $678 a month, either through their own out-of-pocket expenses or purchasing their own health insurance through the marketplace and paying their premiums. They are spending that money post-tax. This is missed opportunity number one for you and for them. I want to be clear that there is no reason not to have some sort of group health plan offering that allows these employees to funnel some of those costs into a Section 125 plan and pay for these things tax-free. And you get to skip out on the payroll tax costs for their contributions. That's at least 7.65% for you and 7.65% plus income tax for your employees. When you have less than 50 full-time employees, you don't even have to contribute anything to this. You don't have to take on any risk. I'm not trying to say you should or shouldn't contribute to any kind of health plan for your employees. I just want us to start from the ground knowing that you are not required to, and let's go from there. I think it's worth pointing out that there is no moral or other high ground by taking care of your employees by offering group health insurance. You have a total budget available when considering compensation for your employees, mixed between take-home pay and benefits, and how you break that out does not change the generosity of the total. When you set up a well-structured, self-funded group health plan, you give your employees the options to take home that pay in the most efficient way possible. You can give them the option to select anything from major medical insurance to dependent care to cash in lieu of benefits. Now, you're probably wondering right off the bat, well, how hard is this going to be? Or how much of my time is it going to take? What are these tax benefits actually going to be? And what are the hidden fees? Well, you will be happy to know that that is why Common Care exists, and we think you are going to like the answers that we have for those questions. If you go to our website and follow the prompts, you will find completely free Section 125 plan designs that are AI-driven and legal team reviewed. Once you have your plan structure and the legal documents required, you have everything you need to begin to implement your plan. But most folks would rather focus on growing their business than health plan administration. That's why Common Care offers low-cost tools to administer your plan according to the ACA regulations. It's also easy to add a third party to manage your plan administration if desired. On top of that, to save even more than the initial tax savings, we offer a suite of cost containment tools that are available for purchase either by you or by the participating employees. These are things like private pay networks and billing mediation tools. So how would all of this look in the real world? Well, let's look at what the data is telling us. A typical Common Care user with 30 employees implementing a totally voluntary plan, meaning no employer contribution, is saving around $16,500 in payroll tax costs. That's you as the employer. That means your employees are also saving another $16,500 plus another $21,000 in income taxes. Beyond just the tax savings, this group would save another $37,000 in employee out-of-pocket spend. That means in this scenario, the total savings for employer and employees combined is over $91,000 per year. And what is the cost for the full suite of Common Care tools and administration in this scenario? $30 per month per employee, which can either be paid by you, the employer, or passed along to the employees. So you can see why exploring this option is a no-brainer for anyone not currently offering a group health plan. So head on over to commoncare.org, follow the prompts, and let's see what the savings can be for you and your employees.